Did you know hospitals across the country are actually furloughing healthcare workers, laying off hospital employees? It's true. 700 healthcare workers were furloughed by Mercy Health in Cincinnati. 700 more were furloughed in Boston by the Boston Medical Center. 500 more furloughed in Kentucky, 400 in Connecticut, 200 in Tennessee, more in New Jersey, Oregon, Virginia, Arkansas. Because state governments are mandating that private practices cancel non-essential surgeries at hospitals. Did you know hospitals across the country, especially in rural areas, are at risk of shutting down completely because they have no patients? It's true. 25% of rural hospitals are now at risk of closing due to the cancellation of so-called non-essential medical care. Smaller hospitals, even with Medicare advances, can't absorb the losses to their profit and remain open. And many of these rural hospitals are the backbone of the economy, the primary job creator in the towns where they're located. Did you know private medical practices, your primary care provider, is at risk of going under and their business is closing permanently because all government forced the cancellation of non-essential surgeries? It's true. 40% of family medicine clinics are at risk of closing by the end of June. Imagine the devastating impact that's going to have on people's health. Did you know that Quest Diagnostics, which has so far processed 40% of COVID-19 tests in our country, is furloughing employees, cutting pay, dismissing temporary workers, and cutting overtime? It's true. Thanks to social distancing, Quest has no profit from the regular tests they perform to earn the money to pay their employees. Did you know that nobody in our country has not gotten a ventilator who needed one? It's true. Vice President Pence, as well as state governors across the country, have confirmed that everybody who needed one has gotten a ventilator. Did you know 0 hospitals in the United States have been overwhelmed to the point of collapse? It's true. Not a single hospital in our nation has been forced to ration care or deny care to COVID-19 patients. Did you know that the Army Field Hospital in Washington State closed because they saw 0 patients? It's true, 0 patients. So they built it based on doomsday predictions, and then they tore it down. Did you know in Los Angeles and in the UK, during flu season, hospitals had to build surge tents for their overwhelming patients infected with influenza? In Dallas, hospitals turned away flu patients because of overcrowding, but the media barely noticed it then. It's true, the media just didn't report it because it wasn't salacious, because it was only the flu. Did you know in New York City, hospitals were overflowing and their emergency rooms looked like a war zone all the way back in autumn of 2019? It's true. New York City hospitals have had issues long before COVID-19, and it's disingenuous for reporters who never even peeked into a New York City emergency room before now to try to make any comparison and blame the conditions on COVID-19. Now, this is not to downplay hospitals in virus outbreak hotspots that are hustling. Some hospitals are downright busy, some are crammed. What I want you to do with this information tonight is realize that much of what you were told, what you heard at the beginning of this outbreak, whether it was viral videos of nurses crying on Instagram about limited respirator masks, whether it was reports of do not resuscitate orders or rationing of ventilators, whether it was video from Italy that the mainstream media was showing when they were talking about the virus outbreak in New York City, whether it was former public officials like Tom Bossert predicting on March 10th that our hospitals will be creamed like Italy's, which collapsed after 10 days with 1,000 extra patients, that was all projection, people's guesses. What we're seeing now, everything I just showed you, is reality. Don't get the two confused. And don't let politicians use projections to build political policy when the projections do not match the reality.